Gout is the topic for this video, and I have some clinical vignettes to show as well. Gout is a very high yield topic. It's basically the accumulation of these uric acid crystals into the tissues, and the most common place or body location is the great toe. That's very commonly shown on clinical vignettes. And this can be either acute or chronic. It can happen on an ongoing basis in patients as well. I will go into detail about all of this. So why does this happen? What is the reason? Well, there's three basic reasons. The first is the person's uric acid level in their body is normal, but they are not able to secrete it by the kidney. So these are known as undersecretors, people who are undersecretors, and this is the number one cause. I think 90% of gout cases are undersecretors. Another cause is overproducers, people who produce too much uric acid. And then those are the two main categories. The third actual reason that is exogenous, meaning something you do rather than something the body does, is that is your diet. A diet can cause gout, in particular organ meats. Now, what do we mean by organ meats? Meats that basically come from an animal's organs. So, for example, some people, they eat liver or they eat kidney, or this type of meat is very high in purine, and a purine-rich diet can lead to gout or cause gout. Another cause is alcohol. It's important to mention that, and that's why some patients can get gout attacks as well. So let's get into the symptoms. Well, basically the symptoms are very simple to explain. You know, you've got the great toe is infected. There's a name for it. If the great toe is infected, most commonly it's called podagra, and you'll have swelling, you'll have redness, you'll have warmth, very painful. This, like I said before, it can happen acutely or it can be an ongoing chronic issue. Diagnosis, most of the time, gout is just diagnosed by observation, because most physicians can just look at it and say, well, you have gout, or this is the sixth time you've had gout. Most patients, because it's chronic. But there are two tests that you can do, not always done, of course. Uric acid level, serum uric acid level, and then a really cool test that they test on licensing exams is what you do is you aspirate the synovial fluid from the joint, and then you look at it under a microscope, and they will be negatively bifringent. That's a terminology used to describe how something appears under the microscope. And we're of course talking about the uric acid crystals. And then finally the treatment. There's treatment for acute, and then there's more long secretors. There's one treatment, and then for overproducers, there's another treatment. For undersecretors, it's probenecid. And for overproducers, it's allopurinol. So those are the main medications involved in the treatment of gout. So let's go and look at some clinical vignettes. 69-year-old man presents with complaints of excruciating right foot pain. Pain began 6 hours ago. One night earlier, he had gone out for a steak dinner and drank half a bottle of wine to celebrate his recent retirement. Past medical history significant for blood pressure, takes hydrochlorothiazide. Physical exam, he's afebrile, but appears acutely uncomfortable. Swelling, tenderness right in the right ankle and first toe. Lab tests reveal a white blood cell count of 12,000, hematocrit 39, serum electrolytes and liver function tests are normal. Uric acid is also normal. Which of the following was most likely seen on examination of the joint arthrocentesis? Well, he's definitely got the diet. He's had some meat. He's got some alcohol in there. So those are risk factors for developing joint. Even tells you first right toe. So, I mean, that's a classic location. Interesting, uric acid levels normal, which can be 30% of cases, uric acid level will be normal. Now what they're asking you is that you aspirate the synovial fluid from this joint. What will it look like under a light microscope? And that terminology is negatively bifringent, so that gets rid of these two, and they are needle-shaped crystals, so that would be B. Next question. 83-year-old man with history of obesity, diabetes, high blood pressure, chronic renal failure, hyperlipidemia, and coronary artery disease comes to your office after being awakened from sleep by severe pain in his right first toe. He says that he had sudden onset of acute pain in the toe rapidly following erythema, swelling, tenderness, and warmth. So you've got erythema is redness, swelling, pain, and then it's warm to touch. Physical exam is normal except for swelling and severe tenderness over the metatarsophalangeal joint on the right foot. At this time, the most accurate statement is, well, let's go through these one by one. Allopurinol would be reasonable therapy now by decreasing his serum uric acid levels. This case is a case of acute gout, and acute gout is not treated with allopurinol. Chronic gout is managed more with allopurinol, so that's not the case. Decreasing his dietary protein may have a role in decreasing frequency of recurrent attacks. Well, that's good. I like that. Most patients will only experience a single attack in their lifetime. And that's not true. Most patients actually will have recurrences of gout in their lifetime, so it's not C. Overproduction of uric acid is the etiology of these attacks in most patients. Actually, that's not true because the most common etiology is under-secretors. So, by process of elimination, it would be B. And one final one. 44-year-old businessman presents to physician because of marked toe on the right great toe. States that he just returned home from a convention, noticed increased pain in the right foot during his plane trip home. Physical exams remarkable for swelling and erythema of the right great toe, as well as small nodules on the patient's external ear. Aspiration of the metatarsophalangeal joint of the affected toe demonstrates needle-shaped, negatively bifringent crystals. Which of the following agents would provide the most immediate relief for this patient? Well, they've all spelled it out. They spelled it all out for you. And this is acute gout. And in acute gout, you would treat it with colchicine. So that would be choice C.